Hello, my name is Amy Sturkey. I am a pediatric physical therapist. I'm here with Rebecca, and she is the mother of these two twins. This is Eli and Ellia, and they are 2.5 months old.
Yes.
And they were born at 35 weeks.
35 weeks, 5 days.
5 days. And they are fraternal twins, obviously. And I just thought I'd take this opportunity to talk about the risk factors or the problems that often go along with twins. There are 3 things that often happen with them. It's not uncommon for them to be premature, to be small for gestational age, and to be low birth weight. So I thought we'd just unpack a little bit those 3 things.
Sure.
So the first one is premature. Now in the United States, most babies are born, what they classically say is full term is 40 weeks, but medically anywhere between 37 and 40 weeks is considered full term. You said that they were born at 35 weeks, 5
and 5 days, so almost 36 weeks.
So in terms of prematurity, they grade how premature you are. So babies that are born from 34 to 36 weeks, that's considered late preterm, so that's what they were.
Yes.
So not as preterm as some babies that are born from 32 to 34 weeks, they're moderately preterm. Babies that are born before 32 weeks are very preterm, and babies that are born before 25 weeks are extremely preterm. Babies as early as 22 weeks can survive. But these babies are more likely to have developmental disabilities or health problems. The research says that babies who are born preterm are more likely to have longer hospital stays. So an average stay for a baby in the hospital is 1 to 2 days. How long did they stay in the hospital?
Ellia was 5 days and Eli was a full 7, so a full week. And he was in the NICU. She actually was able to be discharged after just being in the mother-baby unit. So she just needed a little extra time, and the doctors are trying to get them to be released close to the same date, so I don't have to take one baby home and one baby in the NICU.
Right.
So, but he needed a full week in the NICU.
And why did he have to stay longer?
He couldn't latch, so we were breastfeeding, and he couldn't, because they said they were premature, like they said just due to immaturity, they had trouble latching, so, and then he eventually had to do a feeding tube. Like we tried spoon feeding him, and he had, I'm saying feeding tube, an NG tube with the one out of your nose. And his O2, he had trouble with his O2 sats. They just would randomly drop sometimes in the night. One of the biggest things was his temperature. He could not seem to control his temperature. They said he was burning too many calories trying to eat and latch, and he couldn't. And it would just cause, I think there was weight issues as well. And the other one was his blood sugar. He failed a few of his blood sugar tests. So he had just several things he just didn't seem quite stable enough to stay upstairs with us in the mother-baby unit.
Okay.
So, yeah.
So they are more likely to stay in the hospital longer, and also just more likely to have health problems in the first 2 years of life. Yes. So they haven't had any other health problems so far?
None, yeah. Been pretty healthy otherwise.
And the next thing is small for gestational age. So they say it used to be that they would compare twins against singletons. Singletons is when you have just a single baby. But what they found is twins don't grow as much in the last trimester as other babies do. So they found it's important to compare twins to twins. Otherwise, they were doing medical procedures too much. So children that fall in the 10th percentile compared to their peers, and they're looking at their length, their weight, and their head circumference. They probably monitored that all along to make sure that they were doing well.
Yes.
But babies that are considered small for gestational age, they're more likely to have cardiovascular problems. But these two were not small for gestational age.
They were back and forth around 50%, like around average. Some would be sometimes they would be 46% when they'd say their growth, and then sometimes like up to I think 65, and then there would be 50. They stayed pretty close together in a pretty normal, size overall.
Good. For
their section, but I think they were only in the 5-pound range because of when they came. So
right.
Yeah.
There is a growing body of evidence that babies that are small for gestational age are more likely to have difficulties with intelligence, more likely to have difficulty with school performance, social competence problems, and behavioral problems. But interestingly enough, The research says that if you breastfeed for 6 months after birth, that helps ameliorate some of those issues. But again, that's not issues that they had. The next one, and the third one, is being low birth weight. So an average baby in the United States is 7.6 pounds, or that's 3,500 grams. And how much were they when they were born?
Eli was 5 pounds even, and then Ellia was 5 pounds and 10 ounces. She was the bigger baby.
So the research says that if you're born below 5 pounds 8 ounces, or 2,500 grams, that you're considered low birth weight. Yes. So he's low birth weight, but she was not.
Just barely. Yeah.
Yep. And then if you're born below 3 pounds 5 ounces, or 1,500 grams, then you're considered very low birth weight. And so he was only a little low birth weight, and she was not low birth weight at all. The research says about children who are low birth weight is that they are more likely to have language problems, more likely to have problems with their hearing and vision, and more likely to have problems with organ functions. As far as you know, hearing and vision are fine for him?
Yeah, all normal.
And so one of the things that's good to know, the things that go along with these risk factors, is because you can just be on the watch out for any language delays for him. What they talk about with twins in general is it's very important to look at the inter-twin birth weight discordancy. So what they do is they look at the difference in their weights. So she was 8
ounces bigger.
10 ounces bigger.
5 pounds 0 ounces and 5 pounds 10 ounces. So she was just 10 ounces bigger.
So if you subtract their two weights, so 10 ounces, and you divide that by the heavier weight, if there's a 20% difference between them, which your kids do not qualify, yes, then those children are at risk, twins are more at risk for long-term adverse developmental issues. When there is a inter-twin birth weight discordancy, those children are more likely to have cognitive delays, they're more likely to have gross and fine motor delays, they're more likely to have attention deficit disorder, more likely to have autism, they're more likely to have tics or stereotypical behaviors, and they're more likely to have febrile or epileptic seizures. So it's all the other things we talked about, the prematurity, the small for gestational age, and the preterm. Those are things that any baby can have, but this is something specific to twins. But again, those are all issues that we don't really need to worry about with them because they did not have that significant differences between their weights. Again, I think it's important for us to know the things that are risk factors for these kids, because if they had, for example, had that significant weight difference between them, then you'd want to know what to be looking out for, because again, the research says that if you can catch things early and address those issues, that babies have better outcomes. I hope this is helpful for you, and we'll look forward to seeing you next time. Yes. Thanks a lot. Bye-bye. If you liked this video and would like to be notified by email when the next video comes out, click the subscribe button here and click the golden bell icon and ensure notifications are enabled on your account.